We're talking about delirium, and that's that confusing state for a patient who has sudden changes in mental capacity. It's upsetting to all, the family, the caregivers. It needs to be assessed and treated as soon as possible to relieve those symptoms. The first, very most important step is a careful assessment. We want to determine what that cause might be and do it quickly, and then it allows for appropriate treatment so the patient finds some comfort. Let's use a mnemonic to help us remember what to assess for. The word or mnemonic is CHIMBOP, C-H-I-M-B-O-P, CHIMBOP. Remember, the questions you're asking are about recent changes, those over the last 1 to 3 days, not the last weeks or months. These are recent changes from the patient's usual status. And note that these changes in each one of these areas can lead to delirium just on their own. Let's go through each initial and what it stands for. C is for constipation. When was the last bowel movement? Regular one. Are they having a regular one? Remember the goal, one good one every 3 days. When a patient's been in the hospital taking narcotics or anything else, it's unusual for a family, not unusual for a family to tell me, oh, it's been 5 to 10 days. Get on that constipation. H stands for 2 areas, hypovolemia, hypoglycemia. Have they started to drink less? Are they getting dehydrated as expected in transition? Or maybe they've been vomiting and haven't been replacing fluids. Hypoglycemia or low blood sugar in someone who's been eating regularly, or perhaps it's a patient with diabetes that's under care and their intake has changed or their insulin doses have changed. I is for infection. Is there a new UTI, pneumonia, a wound infection? Have they been exposed to infection in a facility where others are suddenly and recently ill? M is for medications. Has the patient received any new meds or maybe changes in doses just recently? B is for bladder retention. When did they last pee? Are they agitated? If the patient is using a brief, sometimes it looks like they're urinating, but it's just small amounts from an overfull retentive bladder. Bladder scan that patient if you can, and maybe you're going to have to place a Foley to assess whether they're retaining. By the way, don't use a straight cath. If you find retention, you want to keep that catheter in place for treatment. O is for oxygen deficiency, a low sat that's fairly sudden. New onset of respiratory infection, perhaps a PE after surgery. P for pain. Are they being treated appropriately? Remember, dementia patients or people with delirium can't tell you what they need. They may be in pain and they don't even recognize it. Then you've got this double whammy, somebody who's really uncomfortable and delirious. You might have to use some medication for pain and assess the response. That's CHIMBOP. Do this assessment when you see or think a patient might be in delirium, and do this before you talk to your medical director. They need to know what you've assessed and what was happening when it started. And perhaps look at just the way you did the assessment, you may have already identified what caused it and you can fix it right away, like getting those bowels moving or putting in a catheter, getting the oxygen on. Use those appropriately ordered pain medications. If you have completed a CHIMBOP assessment, done everything appropriate with the interventions, and your patient is still experiencing delirium, absolutely time to call that medical director and talk about intervention. That's CHIMBOP, and that's how we can use it to assess for delirium. Please keep your questions coming. We love to answer them, and visit our YouTube and website, the Hospice Care Plan, for so much more.